I'll just make a start. Good morning, everybody. My name is Teresa Cawley, and I work in the Health and Wellbeing Division in Community Healthcare, Cavan, Donegal, Leitrim, Monaghan and Sligo. And I've been working in service improvement, and I'm just going to talk to you about a test of change that we conducted as part of an mPower project. So I'm going to give you background, first of all, about why we conducted that test of change and how we approached our test, what we found, and what the lessons that we learned were. Okay. That's it here. Okay. So that one there. Great. Okay. That one there. Okay. Okay. Okay, so the test of change came out of a project called the mPower project. And the mPower project was an EU-funded Interreg VA project that was managed by SEUPB. It was a 5-year project. It ran in CHO1. It also ran in CHO8 here in Ireland. It ran in Northern Ireland in 2 areas and in 3 areas in Scotland. It commenced in 2017 and finished in the end of May this year. The project was supporting people aged 65 and older to manage long-term conditions and to live safely, healthily and independently in their homes for as long as possible. So effectively it was supporting an infrastructure for healthy ageing. And we were drawing on wellbeing plans and e-health and digital technologies. So in this area, the Health and Wellbeing Division linked with the key stakeholders for older person services, and some of them are here in the room today. Our dementia lead here, Sharon Richardson, for this area, and Maura Heffernan is here as well, the new Director of Nursing, and previously working with the Integrated Care team for the older person services. We worked with the Falls service, we worked with occupational therapy and older person services, and we worked with dementia services and the Falls team to identify the need. Okay, so we were looking at home and mobile health monitoring, and we had a small period of time to conduct a test to change. So meeting with those stakeholders, we identified a gap around the area of Falls devices. In this area, the Falls device that tend to be used and that people hear about are non-GPS Falls detection devices. And the downside of those devices is they only work within about 50 metres of the home. So we wanted to test out devices that would allow people, as we presumed, to be more active. And when we look at the evidence, there's a significant proportion of disability that's associated with old age is as a result of disuse and not disease. The risk of falling increases with age. 1 in 3 older people fall every year, and 2/3 of those will fall again within 6 months. 56% of falls occur outside the home, and handling falls in time is related to 30.5% reduction in the chance of care admission within 1 year. And on the cost side, of course, which is very significant, cost-benefit analyses are finding that investment in falls detection devices gives a substantial benefit based on enabling falls to be handled in time. Okay, so our test to change was we wanted to see if they improved, if they enabled people aged 65 and older to move more freely. We identified a cohort of service users to test the devices, and we identified a provider. The provider we identified was Tunstall Emergency Response, and that was part of an expression of interest that we conducted with providers of home and mobile health monitoring devices in this area. We wanted also for people to increase their familiarity and understanding around the use of GPS falls detection devices. Okay. So we secured funding of 10,000 and we established a steering group to steer the change. And we also negotiated a beneficial package for the beneficiary. The devices were provided free to the beneficiary. We provided free monitoring to the beneficiary for the first 6 months and reduced monitoring then for life. So just for your information, you'll see pictures in later slides of the falls devices that we tested. We tested a pan which looks like a watch, and we tested a pebble which looks like a pendant. Both devices can be activated as a result of falling, or they can be activated directly by the user. So that's just there for your information. Okay, in terms of our approach, we established a steering group to oversee the test to change, including the evaluation. We took a mixed method approach, and we developed an assessment tool and agreed suitability and referral pathways and processes. We also gathered data from the monitoring by Tunstall Emergency Response on the activation usage, non-usage of the devices. We also linked with the users and their carers throughout the project to get feedback. So we had 26 people who were involved in this test to change. One was 90, 9 were between 85 and 89, 4 were between 80 and 84, and then 13 then were under 80, mainly from Sligo and 2 from Leitrim. We actually had 27 initially for the test of change, and unfortunately one lady who had been very interested and advocated and actually recruited other people for us, she just died very tragically. So 27 GPS falls devices, 1 base unit, were procured and programmed by Tunstall. And we provided 24 pan-pans to test and 2 pebbles. We received 23 referrals from the local fall service, and they identified people who were attending exercise classes, and these were people who were identified as at risk of falls. We also had 4 self-referrals, and as I mentioned, that lady passed. We had 3 devices returned to us, and the reasons given was one person said they weren't leaving their home, so they didn't need a device to allow them to move outside their home. One person said the watch was very bulky, and interestingly, I spoke earlier and heard about a similar complaint from somebody else. So we have provided that as feedback to the company. One person did not use the device as it was ordered by a family member, so we felt that's very important learning for us. So in terms of our findings, we found that in terms of time walking per week, after the test of change, we found that there was a 35% improvement in people in terms of their time spent walking. So that was for 7 people. 10 people sustained their level of walking. Additionally, 32% or 6 people increased their engagement in activity. Outside the home, 42% or 8 people sustained their level. 32% or 6 people increased walking alone, and 32% or 6 people sustained their level. In terms of fear of falling, we asked people about their fear of falling before and after, and we found that 60% or 12 people had a reduction in their fear of falling with wearing the device. And additionally, 60% or 12 people had a reduction in their fear of falling after the initiative when they were asked, "Are you afraid of falling?" In terms of satisfaction with the device, 78% of those who responded, that was 18 people, found the device easy to use and the device met their need for 61%, and that was 14 people, and 61% or 14 people intend to keep using and recommend the device. In terms of issues, you will be aware that there are issues that are very common with fall detection devices, so we looked at these issues in our test to change. The battery recharging is an issue, and we were advised by the company that it needs to be recharged every 2 to 5 days. We found in this test that 52% or 10 people recharged every 2 days, and 48% or 9 recharged every day. So low battery is a common problem, and it's also very related to the activity level. So it takes a while for people to get used of the device in their lifestyle, and depending on where they're moving and picking up Wi-Fi and that, it can fall off faster. But people get into a habit and they know what works for them. Suppliers say false activation of the device is a common issue with devices, and we found that. In our test, there was only one true fall activation. The others were accidental, where the provider or the client were testing the device. We did find after 6 weeks that activations were significantly reduced. So there again, it's something that's going to be a factor initially, and for people to be prepared for it, but it will improve. And in terms of devices and the monitoring cost, 40% saw the cost of the device or the monitoring as a barrier. So it is something that we need to consider going forward in terms of enabling people to buy and to have these monitored. Sensitivity, just for your information, can be adjusted. Now, this is just some feedback, and this is a picture of the pan. So it looks like a regular watch, although it tends to be a bit more bulky. One participant said, I went down the steps into the garden and with confidence that if I fell, I would be okay. Another participant said her mom uses the pan and it gives her confidence to move. With the pebble, and that's the pendant, one participant's son advised that his dad looks to put on the pebble every morning. He's happy with this pebble and feels more secure when wearing it. So we found that the GPS falls detection device did help people in Sligo and Leitrim to be more active. We had some issues with connectivity, and we did identify some barriers as well that we fed back to the company and that we've also factored into our recommendations. And we feel it's very important that people buy into wanting the device for themselves, and that it takes time to become familiar with the device. Just for your information, devices that are available, the standard non-GPS is available through Pobble to people over 65, and there's a small cost for monitoring, but it's non-GPS. Alone provide free GPS falls detection devices to people aged 60 and over, and then they have to pay for monitoring. Some companies give choices of devices with varying prices for devices and monitoring. Other companies only offer the home mobile health monitoring as a package. So I'm just going to conclude at this. Even though it was a small test to change, it demonstrated that beneficiaries were more active, especially on their own. They were less fearful of falling, so therefore it afforded opportunities for them to connect to people out and about, reducing their social isolation, maintaining independence and delaying deconditioning. It also increased the confidence and peace of mind of their carers and their families. The falls detection devices are still new, particularly in this area, but people were open to them. Early education on the options available is very important because it takes time to become familiar with these devices. So that concludes my presentation. Thanks very much.
Thank you very much. No, don't go just yet. And we were just talking earlier on this morning about how much energy it takes to try and do service improvement, because so many clinicians and are so flat out with sort of the day job, they often find it difficult to stretch that bit further. So well done. Now, last time I neglected to check if there's anybody on the online aspect of our conference, so forgive me. Brian, are there any? Not, sorry, and I think I missed somebody last time. Sorry about that. So, is there one question?
Do you look at the range that the patients in?
We did, and some went quite extensive distances. The GPS works. If they went to Africa, it would still work in Africa. It's SIM-enabled. But we monitored that with Tunstall Emergency Response.
So what sort of percentage increase did you get in range?
Sorry. What increase in range?
Yeah, how much further did the patients feel confident to go?
Okay, we didn't measure that. It was more that we could see what their activity was. It would be interesting. Yeah, thank you. Hi.
I have seen some failure detection instruments in home care. Have you ever tried to integrate with those devices to increase the accuracy of the measurement? Failure detection, there are other devices, similar devices, which detect fall on home care facilities. So have you planned to integrate those devices with this one to increase increase the accuracy of the fail detection rate?
Yeah, it was really a small test that we were conducting, and what we were trying to do was support older person services and services in general to open up to home mobile health monitoring. So it was a very small test that we were doing. Thank you.
Okay, thank you.
Thanks very much.
you.
Thank you.
Thank you.